Hello, SCHICK Nation. My name is Dr. Ugo Iroku, and I'm here to discuss what are some of the most common digestive diseases that affect people aged 35 years or younger. Uh, this is an age where people feel like there really is nothing that can touch them. You feel like there really are no diseases that apply to you, but oftentimes digestive symptoms are the very first clue of mortality. It's the first sign that you can't do whatever you want to do without your body giving a warning sign on the dashboard saying that you need to slow down and take it easy. And so we're going to review 7 of the most common digestive diseases that affect people on this age. The first one I have to talk about is called gastritis. What is gastritis? Gastritis starts with the word gastro, which means stomach. The phrase itis means inflammation, and all it is inflammation in your stomach. Your stomach being that organ that sits at the bottom of your diaphragm, just waiting for food to come down. It's filled with acid. It's a very caustic environment designed to be able to digest whatever you put down there, whether it's salads, whether it's meats. It's designed to be able to break all of that down. Unfortunately, some of that effect can also occur on your own body, on the lining of your own stomach, causing irritation, causing ulceration, which can bleed. And so the way to avoid gastritis is to be mindful of some of the things that can be irritants. Sometimes we consume too much in terms of acidic contents, whether it's juices, whether it's minerals, sodas, like Coca-Cola, Pepsi-Cola. These things are caustic and sometimes can cause further irritation to the stomach. Along with gastritis, there's a sister disease called GERD, which is gastroesophageal reflux disease. And that's the esophagus essentially being involved now in all the activity of digestion that's going on in the stomach. It's no longer just staying there, but some of it is actually refluxing up. And so this irritation involves not only the stomach, but now also the esophagus, forming its own component of this thing we call GERD, gastroesophageal reflux disease, or acid reflux. Sometimes acid reflux is interpreted as chest pain, chest burning. Some people interpret it as a nausea. So sometimes the refluxing is so severe that it causes coughing, sinus infections, sore throats, loss of voice. All of these things can be adjusted or addressed by avoiding certain items in our diet. And so again, as well as avoiding some of the items that are citric and irritating to the stomach, some additional things to avoid would be things like coffee. Coffee is acidic, yes, but also can increase the likelihood of reflux. Other things that can do that as well include things like peppermints. You will have to watch out for things like tomatoes, which can cause irritation, acidic irritation. Things that are carbonated, again, just causing a lot of irritation. Things that are fried or greasy can also cause the food just to stay in the stomach and cause a lot of irritation. So some of these foods I've mentioned are things that need to be avoided that can cause a lot of irritation and problems for both gastritis and GERD, gastroesophageal reflux disease. So once we now have left these two organs and we're traveling further down into the intestine, another organ that's quickly brought into play is your gallbladder. And people can have gallbladder disease aged 35 years or younger. Although it is more common in people who are older, it can also happen in younger people as well, and I've seen it all the time. What can happen to the gallbladder? It's a good question, but even before we get to that, let's answer the question, what is the gallbladder? The gallbladder is an appendage that sits on your liver and essentially collects all the bile, digestive juice that the liver produces and stores it in the gallbladder. And its job is that when the food is passing the stomach and entering now into the small intestine, the gallbladder now dumps that digestive juices into the small intestine to help digest it. What can happen to the gallbladder? Well, the gallbladder can have stones form within it, causing pain. We call it biliary colic, but you can just call it gallstones. The gallbladder can also have what we call a cholecystitis, which is an inflammation of the gallbladder, essentially an infection of the gallbladder. And in these cases, whether it's biliary colic or whether it's cholecystitis, in either case, the gallbladder needs to come out because otherwise it can cause continued pain and cause other problems, including some of the stones leaving the gallbladder and causing blockages down the digestive path within the liver pancreas region that's also attached to the small intestine. So long story short is the gallbladder, very essential to digestion, but yes, can become inflamed and irritated itself. And it's a digestive disorder that people in their 35-year or younger category can still fall prey to. How do you avoid this? Make sure you stay very hydrated, avoid overuse of alcohol. These are just some common things to avoid. The gallbladder can be very sensitive to overuse of alcohol, overuse of fatty foods. And so when it is affected, avoiding these foods would prevent over irritating the gallbladder as it's trying to work to digest the alcohol and to digest fatty foods. When your gallbladder is in play and when your gallbladder is irritated, avoiding those foods will help. And so then to travel further down, into the small intestine, there is a phenomenon that some of you are aware of. It's called lactose intolerance, very common in people aged 35 or younger. What is lactose intolerance? Lactose intolerance is where the key sugar in dairy products called lactose is not tolerated by your body. And why is that the case? There's an enzyme that's designed to break down the sugar that's found in lactose. It's usually very present young in life, but as the human body ages, the need to digest milk is thought not to be as key, and the body, in many cases, loses its ability to break down milk so it's properly digested. So babies have this enzyme in sufficient quantity, but oftentimes it is lost, especially in African American or African people in the African Black diaspora throughout the world. Oftentimes this ability to digest milk is lost later in life, and that's something that we commonly see in the 20s and the 30s as well. And so the problem is that if you're unaware you're lactose intolerant and you're trying to drink milk, have ice cream, have more cheese than your body can handle, this food products are not being broken down by you. And so who breaks them down eventually? The bacteria in your gut does. Because you're not able to break it down, the bacteria in your gut will break it down. Unfortunately, they're notoriously messy eaters. And when they break it down, they produce a lot of methane and sulfates and hydrogen gases that cause a lot of distension, bloating, diarrhea, very explosive flatulence. It can be very uncomfortable, not just for you, but for anyone around you. And so it's very important that to avoid this, that you kind of are aware and you avoid doing dairy products. You can have foods that either have the enzyme added to it or the sugar taken away from it. There's some preparations that have that, or you can just avoid dairy altogether if those more fancy options where the food is actually manipulated so that it doesn't have that sugar are not available to you. You avoid dairy. All of a sudden, a lot of the symptoms you've been suffering from, the pain, gasiness, diarrhea, goes away with avoiding the dairy. Number 4, I would like to mention is a situation very similar to this. Actually, number 5, I would say, is a situation very similar to lactose intolerance. This one is called SIBO, small intestinal bacterial overgrowth. Small intestinal bacterial overgrowth is a condition that also affects the small intestine of people. And it's very similar to a situation of what's going on with lactose intolerance. Lactose intolerance is limited to just the lactose in dairy products. But with SIBO, with SIBO, it's no longer limited just to that population of people. There are many sugars in many different elements of food that also have sugars. They may not be lactose, but also have sugars. And these sugars, if they're consumed, will affect the bacteria in your gut and make them produce all the gassiness and bloating and diarrhea that lactose intolerance can do as well. And so there's fructose that exists in fruits. There's other sugars like polyols, sorbitol, xylitol. These are some sugar supplements that are used in artificial sweeteners. So if you're chewing a lot of quote unquote sugar-free gum, you might be consuming a lot of sorbitol and xylitol, not realizing that these can also cause a lot of bloating for some people. And so long story short is, if you have SIBO, small intestinal bacterial overgrowth, one way to avoid it, the symptoms from it, is to cut down on a lot of those artificial sugars, to be aware what foods cause your symptoms, to keep a little food diary. And if you start to see a pattern, I'm eating pastas and then I'm having bloating, or if I'm eating, sugars and then I'm having bloating, then you can make that correlation between the food and the symptoms that you're having and try to avoid that specific food. There are ways to test for SIBO, not widely available, involving a breath test, but even without the existence of the breath test locally, you can still sometimes just have an empiric treatment, so a clinically monitored treatment of antibiotics to see whether or not that does the trick of calming down those bacteria in your gut down so that you can consume the foods without having so much problem. Then to go down, the next up would be constipation. Constipation is a very common digestive issue that can occur in people age 35 or younger. Constipation is just what it sounds like. You're constipated. You can't move your bowels. Your bowel movements have gone from an average, altogether people have an average of moving the bowels once a day, to it being less frequent than that. If normally you're moving your bowels 3 times a day or 2 times a day, if that's normal for you, then constipation for you may be going just once a day. There's some people who always go 3 times a week. That's just how they've been all their lives. Constipation is when it becomes worse than that. And so whatever it is, constipation can be something that can affect you. What are the ways to avoid it? A big way to avoid it is to make sure you're eating a lot of fiber in your diet. Every female listening to this podcast or to this message, and every male listening to this should be consuming either 25 grams for females or 35 grams for males daily. With a lot of fluids, 8 glasses of water a day, that usually should help prevent you from becoming constipated. However, once you do become constipated, it's important to touch base with your doctor to see, does this reflect anything that's alarming? Your doctor will help you figure that out. Sometimes people need further testing, including even all the way up to having colonoscopies. And sometimes it might just be a change in diet. That's all that's required to keep things moving along. Again, with a high fiber diet, a fluid, sometimes if that's not enough, your doctor might start you on a stool softener. There are many that are available and do the job to soften the stool and to make sure you're moving your bowels properly. And so these are some of the common digestive disorders that can affect people even in the 35 or younger age. Pay attention to your body, follow these advices, and you'll find yourself avoiding a lot of these common problems. Till the next time.